Hello, and welcome to the Refinery Skin Clinic. My name is Rebecca Seuss. I'm a registered nurse and injection specialist at the Refinery Skin Clinic in Burnsville, Minnesota. Here at the Refinery Skin Clinic, we believe that education is of paramount importance, and that is why we have developed our year-long series entitled The Truth Is, where each month we cover a new topic in soft aesthetics. Today I will be discussing lip augmentation and how to achieve a defined, lifted, and most importantly, natural-looking result. Let's dive in. Who has lip augmentation? Well, I think there are some pretty obvious celebrities that pop into our heads as soon as we say lip filler. Big Ange, Kylie Jenner, or any of the Kardashians really, and Lisa Rinna are just a few of the ones I hear from the clients when they sit in my chair. But some of the lesser known, not so obvious celebrities you may not have known about have a much more subtle, natural looking result. Jennifer Garner, Nicole Kidman, Julia Roberts, and Gwen Stefani, just to name a few. When we talk about what lip augmentation is, we should really start with what it's not. It is not designed or intended to simply blow up the lips and make them bigger. The end result should never be duck or sausage lips. Even if the goal is to have larger lips as an end result, this should be completed in stages with multiple syringes of different fillers. The primary goal of lip augmentation is to simply bring blurry-looking lips back into focus. We do this by injecting the entire perioral area together to achieve the most natural-looking result. If we are just augmenting the lips and ignoring nasolabial folds, marionette lines, or the prejoral sulcus, we are not going to get the best and most natural-looking result. Beyond keeping the entire perioral area looking symmetric, it is important to remember that there is a golden rule to lip injections: maintain the proper proportions. When lips are enhanced, they should always maintain the natural anatomical shape. This is where it is important for you to talk with your injector. Do they understand the balance that is needed to maintain a natural appearance to the lip? Do they understand the need to treat all areas and not just the lips? It is a good idea to bring in some pictures of lips with you that you are looking at, but your injector should review with you what is a realistic goal for you specifically. Just like bringing in a picture of your favorite hairstyle to your stylist will give them an idea of the type of style you are looking for, in the end, the type of hair, or lips in this case, you have will ultimately dictate your result. It is always better to work on enhancing what you have rather than trying to create something you don't. Another important factor in your lip augmentation procedure is the type of product that is used. I favor the Allergan line of fillers for lip augmentation as they yield predictable and reliable results with no surprises. Each filler is designed to be used in a different area of the lip or perioral area. For clients with little to no lip that need to put a lot of structure back into the perioral area, I lean towards Juvederm Ultra or Ultra Plus. It is a little firmer product that puts some lift and turn into the lip. For those that are looking for a subtle, slightly plumped, and more hydrated look to the lip, I recommend Volbella. Sometimes we need multiple syringes for different areas. I may want a firmer filler to add some structure to the lip, but a softer filler inside the body of the lip for a subtle enhancement. This is where the one-on-one consultation is best. We do everything we can to make lip injections comfortable. We start with a topical numbing cream and use ice at the injection site to help with the initial pinch of the needle. I also utilize microcannulas for lip and perioral injections. This reduces, not eliminates, the risk of bruising and minimizes tissue trauma during injections. This helps with post-treatment swelling. Beyond the comfort measures we take in the clinic, Allergan also adds lidocaine to all of their fillers, so once you get past the initial pokes, you'll start to get pretty numb. That numb feeling will usually last about 45 minutes to an hour. Here you can see what lip injections look like. Our model has already been numbed using a topical cream for about 10 minutes. If you are a little squeamish, you may want to just skip this section. We start by using a blunt-tipped cannula to enhance and define the border of her lip. This is the area where lip liner would typically be placed to enhance the lip. There is a small needle poke that is made to allow access for the cannula. Since the cannula is not sharp, that step is needed to allow access into the lip border. After the border is defined and outlined, upper and lower, we use tiny micro syringes to give a sharpness to the Cupid's bow and a subtle lift and outward flip to the lip. A little massage is done to make sure there are no residual lumps or bumps. Here you can see her before and immediate after photos. Stay tuned to the end where you'll see her before and after pictures, but you'll also see her a few days out. Here are some of my before and after photos. In these clients, you can see where we use some Juvederm Ultra and Juvederm Ultra Plus products to improve the look for the lip, but also the marionette lines and oral commissures to take away the downward turn or frowning appearance of the mouth. In these clients, we use lip filler to restore a natural symmetry and balance back into the lip. In the first client, we used a syringe of Juvederm Ultra to put some structure and definition back into the lip. In the second client, we used the softer Volbella product in order to add a little fullness to the upper lip for balance, but not give her too much eversion, just the fullness. These two lovely ladies are a little younger, late 20s, and we're really looking for a fuller, plumper end result. When you're a little younger, 20 to 40, you are able to handle some enhancement and fullness, so this is the time to just go for it. The first client used a syringe of Juvederm Ultra Plus to add definition and plumpness. The second client used a syringe of Velour to provide a softer, fuller look without as much structure. All of the clients you have seen above were the result of before and immediately after their lip injections. You should know that there is some post-procedure injection swelling that will go down after a day or two. Here you can see what lips look like before, immediately after, and a few days later. This client used 2 syringes of Volbella for a soft plump, and this gal used a syringe of Juvederm Ultra Plus for more definition and plumping. And finally, this lovely lady from the video used Juvederm Ultra. You can see giving yourself 1 to 3 days to allow your lips to settle, especially after your first treatment, is very important. And finally, we always say, practice what you preach, so I will happily admit that I have been a lip plumper myself for the last 10 years. Once you start, you will realize how important the lips and perioral area are to maintaining a youthful, lifted, and happy appearance. Thank you for taking the time to watch, and please feel free to contact me with any questions.